This is the 1 Million Lives podcast by Laerdal. Listen to healthcare professionals, healthcare educators, and survivors share their best practices and what they've learned from these experiences. At Laerdal, it's our goal to help save 1 million more lives every year by 2030. One life at a time.
Welcome to the 1 Million Lives podcast. Today, we're excited to welcome Dr. Ivette Motola, Associate Professor of Emergency Medicine at the University of Miami Miller School of Medicine and Assistant Director at the Gordon Center for Simulation and Innovation. We'll discuss the global impact of stroke, its evolution in treatment, and the critical role of early detection. We will learn more about the Advanced Stroke Life Support, or ASLS, blended learning course, a vital training program designed to equip healthcare professionals with the skills needed for efficient stroke response. Dr. Motola will discuss how this program enhances early detection and intervention, utilizing innovative online and hands-on simulations. Join us as we delve into the transformative impact of this training on stroke care worldwide. Ivette, how serious or how big is this issue with a stroke if you look globally?
Yeah, so thank you so much for that question, Bjorn. So stroke is a huge global health problem, and I would say burden, and it's continued to grow in its impact. It's currently the second leading cause of death, depending on the part of the world, and one of the biggest causes of adult disability. 12.2 million new cases of stroke occur every year, so the impact is huge. And as you can imagine, if the stroke isn't treated in a timely fashion, or the person remains with disabilities, then that impacts, not just them and their quality of life, but also their surrounding family, community, etc. So the impact is really quite big and can be quite devastating.
And if you look back, we just talked about this before we started. If you look back to the 70s, the 80s, what options did they have when they had a stroke patient?
Yeah, and even into the 90s and the early 2000s, when I was training as a resident, the options were incredibly limited. It was really supportive care. And, we had a lot of empathy and feeling bad for the patients, but there really wasn't a lot that we could do, really for either kind of stroke, but especially for ischemic strokes. I remember that we would try giving heparin just to try to do something, even though the evidence was really not great. Until we, got to start doing what we're doing now, which is really, as you were saying, really transformative in our options now and what we can do for patients.
And what can we do now? I know this is not what the course is about, but just to get the whole story here. So if we find out that the patient most likely will have a stroke or has a stroke, what can we do?
Yeah, so there's a lot of options now. It does depend on the type of stroke, but say for ischemic stroke, which definitely in the developing world is by far the most common cause of stroke, somewhere between 85 and 90% of strokes are ischemic. We now have the option of thrombolytics and then endovascular therapies. And the combination of those can really take someone that's having a major life-impacting large vessel occlusion stroke, meaning a really big blood vessel in their brain is occluded with a clot, and remove that. And if it's done in a timely fashion, they can go back to being completely normal, or at the very least, significantly reduce what signs and symptoms, what abnormalities are left with afterwards to be something that they can still function in their life, right? So the disability significantly reduced. And it's really incredible the pace of how quickly things have moved, I would say, over the last decade. We've had access to the thrombolytics for quite some time, but it's also taken us a while in healthcare, even in the developed world, to get people to the hospital in time, to get both the public and even healthcare professionals to identify stroke. So even having access to the therapy, it's really taken a while to get us here. And then when you look globally, the access to the treatments, the education and the training is really variable.
So the key word here is time. Time from suspicion to treatment. And that's, if I understand this correct, that's where you are focusing your course on, the course that you have been part in developing.
Yeah, so the course covers everything from understanding the why, as we were just talking about, the really getting healthcare professionals to understand the time sensitivity and the potential impact. So covering things from, pathophysiology, the epidemiology, in an overview way so that people understand the why this is so important. The time component of it, that neurons are dying very quickly. And then also, but it takes healthcare professionals all the way through everything that needs to happen. So detection is a big part, is the next big piece. And then being able to implement the treatments and then the supportive care, which is still incredibly important, both in the acute setting and then in the follow-up, whether it's rehabilitation or follow-up setting. The other piece that's really important that's also covered in the course is to find out why the patient had a stroke and implement these, what we call secondary prevention strategies, which is really preventing future strokes. Right. So if somebody had a stroke, there's something going on either in their blood vessels or their heart or their coagulation that predispose them to this. And we want to make sure that they don't, or as much as we can prevent any other future strokes. So it really covers all of that. It's quite rich in content to help healthcare professionals that are caring for stroke patients have access to all of this.
And the work with this course has actually been ongoing for the last 35 years.
Yeah, absolutely. It's been really the only course of its kind for quite some time. It began in the late 1990s, shortly after the first big stroke study showing that alteplase was effective for stroke, which occurred back in 1996 through the National Institute of Neurologic Diseases, so NINDS. But it took, again, a while to just get things moving. And Dr. David Gordon, who is a stroke neurologist and was also really involved in education here at the University of Miami, started this course focused on detection on those first minutes of, is this patient having a stroke, so that they could get to the hospital in time. It grew significantly in the intervening time through a train-the-trainer model. And we had over 125 training centers. In 2019, when we partnered with the AHA in 32 states and 8 countries, which is really exciting. And we actually just presented some research on the impact of the course on healthcare professionals, about over 40,000 of them in these areas. So that's the history of the course. So it was really, it had grown quite a bit and was having an impact, but we also understood that the need was much bigger than what we were able to do, even through this train-the-trainer model. And it worked really well because the AHA, the American Heart Association, was looking to expand their amazing work in resuscitation training into doing some other things that are really important, and stroke is one of those. And so we were connected with the American Heart Association and embarked on this new program.
Can you tell us a little about the different modules of this course? How does it build up?
Yeah, absolutely. So we call it Advanced Stroke Life Support Blended Learning, ASLS for short. And the blended piece is that there is an e-learning component, and I'll talk a little bit more about that. And then there's an in-person simulation-based component. The e-learning component uses adaptive learning. And really, I know that AI is the thing these days, but if you go back a few years, when some of this first started, we've been talking about individualized learning for a really long time, but figuring out how to do that effectively has been a challenge. And this wonderful partner that we had in Europe and that the American Heart Association has also been working with, Area 9, has been working on how to have these e-learning modules in a way that are interactive, but are also competency and outcomes based, not just, it's not the same experience for everyone. So, for example, if you're an expert in stroke or have had a lot of experience, you can rate yourself in that way, and you will get more assessment earlier on. Whereas if you're more novice, you're going to get more of the course content in the way that we often think about e-learning, where you complete a module of information and then you have assessment instruments. But it's very interactive. It's not the kind of e-learning that you can put on the side of a screen and do something else. You're constantly answering questions, and also you have to interact with the media itself. So quite rich in graphics and videos and animations to really cement that learning about what it looks like. What does stroke look like in the brain? What's happening? What do the patients look like? How do the signs and symptoms present? All of that together. So the part 2 is an in-person skills evaluation and practice. So similar to if listeners have heard of the Heart Code courses for resuscitation, where you complete e-learning online and then come in for the skills component, it follows that model. And the learners, the healthcare professionals, will go into a local training center and complete 3 parts. One is demonstrating a stroke screening exam or stroke severity scale, ideally the one that they use in clinical practice. And then they show that they know how to do that with feedback from the instructors. What we've learned is even in something like the NIH stroke scale, which has been shown to be reproducible and with the right training can be quite reliable, there's still variation even when people complete online courses, because as we know, seeing it, reading about it is different than doing, right? We know this. We've been in simulation education for a long time now. And so they actually have to demonstrate and get feedback that they're evaluating the patient correctly using these different skills in the course. And then part B, they have to do the same thing on a standardized patient or a simulated actor that's portraying abnormalities that you would normally see in different stroke syndromes. So now they're starting to really apply and find the abnormalities, and also it's another opportunity to practice their stroke exam. And then we also incorporate into there the stroke system of care. So it's given as a case. So for example, you are seeing a 72-year-old woman who all of a sudden had difficulty with speech and arm weakness. Then they evaluate the patient. They talk about what abnormalities. They rate their scales. Some of the scales have severity components to make sure that it's aligned with what the patient is portraying. And then we put it together into what stroke syndrome or stroke mimic is the patient likely having, and then where would you take them in your stroke system of care? So that's another big piece, right? So we start having them speak the language of their stroke system of care and also understanding where they are. Are they out of hospital? Are they in hospital? What happens next? What needs to happen next for the patient? And then part C is a full simulation scenario focused on management. And it's either management of the stroke itself or a potential complication of the stroke or a potential complication of the treatment of stroke. And so all of those are incorporated as options for the training centers. And we refer to it as a stroke mega code, but of course it's not really a code. We're not doing resuscitation. We're doing all the things that need to happen for stroke patients.
You're listening to 1 Million Lives, a Laerdal podcast.
Out of curiosity, I know that for instance, with myocardial infarction, it's been a big deal and a lot of discussions about this for many years now, that the symptoms and the signs are different between men and women. in such a way that very often myocardial infarction with women is overlooked because it doesn't have the classical signs. Are there any difference like that with strokes as well?
So that's a really great question, Bjorn. So I don't think that there's so much gender-based differences in presentation as there can be with MI. I mean, with myocardial infarction, there's also diabetics, and there's other groups that also could present differently. So we always, try to teach this and think about this. With stroke, I think it's more about the location of the stroke. And so some people can present with just one or two symptoms that may not be that severe. And so that's when I think it becomes harder to think about, is this a stroke, or things like dizziness. Dizziness is a tough thing. I've been in emergency medicine for a long time, and it's one of those symptoms that we're like, oh my God, it could be so many different things, right? It could be your blood pressure is low. It could be your, inner ear is having trouble. Lots of different things can go into that. But one of the things, of course, is a stroke. And so, of course, the central nervous system is incredibly complex. And one of the things we try to do in the course is simplify it enough that people can really, healthcare professionals can really start to have this pattern recognition. But there's obviously some things that are still challenging. Sometimes even peripheral neuropathies can present in ways that we're not sure. Is it a peripheral neuropathy or is it a stroke? But I do think your point is a good one in that, and we try to really focus on bringing awareness to healthcare professionals on those that have higher risks of stroke and just thinking about stroke. There's been a good amount of work really across many disease processes that people definitely get different care. And that can be problematic. And the same things happen in stroke. There's, some good studies that have shown that, women, this isn't, more in the U.S., but, women, African Americans, et cetera, might not get treated as quickly or have access to the same, treatments in the same time. And so we're really just trying to bring awareness to that so that, everyone can be thinking about it, especially in populations where we know the risk of stroke is quite high. And there's, the different places in the world, those populations might look a little different, but bringing that awareness is super important.
So this course has now, in different versions through its time of development, been taken by quite a lot of people and more and more. Is it too early to ask if you can see any results out there in the field with the patients?
I don't think it's too early. I think we've had really a big impact, especially when it's been implemented regionally or in a healthcare system. But even, in places that we've gone globally now with launching the ASLS blended, the Advanced Stroke Life Support Blended Learning course, it's getting to the tipping point, right, where there's enough people, healthcare professionals, leaders within the system or regionally that are engaged, that really gets everyone talking about this. It's been so amazing to see, both in the United States and globally, the level of excitement, because everyone knows that stroke is such a potentially devastating disease. And in so many countries, there's a lot of people that have uncontrolled hypertension or diabetes that's not treated very well, et cetera. And these healthcare professionals are seeing the impact of that. So having them trained in this course, having them feel like there's attention to this and they have the resources and are having the conversations to move that forward is exciting. It's exciting for me to see. It's so exciting for them. And I think it really has an impact, not just on the next patient that they might treat with stroke, but really in starting to implement all of the things that need to happen within healthcare systems for this to work for patients. But we've had a lot of testimonials over the years. And even as we've implemented the ASLS blended learning program, where we hear back from healthcare professionals that are I took the course, and the following week there was this patient that had, whatever it may be. Often it's ataxia. And I wasn't really thinking that, that might be a stroke. I thought, well, maybe they were just drunk or whatever it may be. But I put it together based on what I had just been exposed to in the course and called in a stroke alert. And, this happened for the patient. So we hear a lot of those kinds of testimonials. And again, the study that we completed with the instructor-led course is really exciting and will hopefully be published soon. But we're hoping to do the same kinds of things with the blended learning course. And really, again, because we're already in so many areas in the world, start to get some of that patient outcome, patient impact data of the training.
And again, the target group, those that the course are meant for, are a combination of pre-hospital personnel, like ambulance personnel, but also people working in hospitals.
Right. Absolutely, Bjorn. So there are 3 tracks to the course, the Advanced Stroke Life Support course. There's a pre-hospital track and an in-hospital track, and then what we call the combined track. The combined track is really for those who work in both areas. So folks that are, flight nurses and paramedics, or even physicians that are working in both areas. And we also think that folks that are working primarily with stroke patients, say in emergency departments and things like that, could also benefit from doing both. But also for instructors that are going to be evaluating healthcare professionals on either track, they complete the combined course so that they're able to have the information for both.
So it should also be ideal, for instance, for teachers at nurse colleges, at paramedic schools, et cetera, et cetera.
Absolutely, yes, and even at other training centers that are training healthcare professionals that are already out in the world. So everyone from students when they're first learning this to practicing professionals. And one of the exciting things that's happening. So we are actually, by the time this airs, it should be launched, but we're in the process of launching another course called Essential Stroke Life Support that is focused on healthcare professionals that are working with patients at risk for stroke, but not necessarily part of their primary job is taking care of stroke patients, with the goal again of expanding this detection piece and those first few critical minutes of when a patient starts to have a stroke. And I'm happy to share a little bit more about that. So I think that's going to really focus ASLS as a more advanced course, which is the way that it's developed in healthcare professionals and students that are going to be more often working directly with patients that are having a stroke. And Essential Stroke Life Support for those that are not necessarily primarily taking care of stroke patients, but are working with patients in rehabilitation or at home or in parts of the hospital where patients are at risk for stroke. And so similar to basic life support and advanced cardiac life support, where there's these 2 different levels depending on your primary area of practice, then we can target both audiences because it's really important. Again, that detection piece, identification is so critical because of the time sensitivity of both the treatments, but also neurons dying, right, or nerve cells dying, that we want as many people to have this information as possible.
You talked a little, or you mentioned earlier, to take this course out in the world. I understand it was made in English, but it is also available now in Spanish.
Yes.
And there is also some work underway to make this available in more languages as time goes.
Yeah.
And for people who are interested in this, it is the American Heart Association who is promoting and making this available globally.
That's correct. Yes. Thank you for clarifying. Absolutely. So we partnered with the American Heart Association to develop and begin implementation, but the course is available through the American Heart Association, the main AHA site for training in the U.S., and then the international site for global countries. And absolutely, our goal is to try to get it to as many places as possible. Right now, it's been launched in the Middle East, South Africa, India, several places in Europe, Mexico, and expanding in Latin America to Argentina and Chile and Puerto Rico, as well as Hong Kong. And again, those are sort of the beginning places to additionally grow it. But as you said, language can really be a barrier. In some countries, healthcare professionals also speak English, but that's definitely not universal. And so one of our goals with the global health outreach is to continue to translate the program into more languages as there's uptake and interest in the different countries to be able to train as many healthcare professionals as possible. So I wanted to add a little bit more about the essential stroke life support that I was referring to. So one of the exciting parts about the program is there's quite a bit of innovation also in ASLS, but as we were thinking of trying to reach as many people globally as possible, we realized that the in-person component is sometimes a barrier. And again, because this is a shorter course really focused on detection, we wanted to still have an application component where they got to practice the skills of doing a stroke evaluation. So the Essential Stroke Life Support course is a partnership with the American Heart Association and the University of Miami Gordon Center, as well as Laerdal Medical and their virtual simulations. And so the application piece, they still complete an e-learning component through the adaptive e-learning platform through Area 9 at the AHA, but also now will complete virtual simulations. So they have to manage patients and evaluate patients that are potentially having a stroke through these virtual simulation cases, which is really exciting to incorporate that piece of computer-based simulation and have that be an option again to more and more healthcare professionals globally.
Well, thank you very much, Ivette. This was very interesting. I hope that we will see that over time that this course, together with other things as well, will reduce the number of people suffering from the consequences of strokes, and those who still get strokes, that the consequences will be milder and easier to live with. Thank you very much, Ivette, for your time. It's been very interesting to hear more about this.
It's been a pleasure, Bjorn. Thank you so much.
You have been listening to a 1 Million Lives podcast by Laerdal. You can find all our podcasts and access any bonus material on laerdal.com/podcast. The views, information, or opinions expressed are those of the guests and do not necessarily represent those of the institution they are affiliated with or of Laerdal Medical. If you have any suggestions for guests or topics we should cover, please send us a message on laerdal.com/podcast. We look forward to hearing from you.
Until the next time, goodbye from the Laerdal podcast team.